More and more women looking to have children later in life. Delayed motherhood is now becoming the new norm. Today, 1 in 7 children is born to a mother over the age of 35. With so many young women putting off pregnancy, the option of egg freezing seems like the perfect solution, so-called insurance policy. But does banking your eggs guarantee a pregnancy? I asked investigative reporter Elizabeth Leamy to find out the truth about egg freezing.
It's Thursday night in New York City. Cheers. And 100 single women are unwinding after work at an egg freezing party.
Egg freezing is definitely a realistic option right now.
So interesting, so I've just been thinking about the topic in general.
Parties like these are a chance for doctors to give a crash course in egg freezing.
So delighted to see this room so full with women, because just the fact that you're here means you're thinking about your reproductive health.
And to push the newest frontier in fertility science.
For me, I travel a lot and I'm working a lot, and I haven't really thought about starting a family. So I definitely wanted to know, is it something that I can kind of pause the clock and stop time?
For younger women who want to have it all and not worry about their ticking biological clocks, egg freezing has been hailed as a game changer, a fertility insurance policy.
Our practice used to be primarily infertility patients, and now about a third of our practice are patients electively seeking to preserve their fertility by freezing their eggs.
But let's go back to the numbers. Only about 1 in 4 of all women who freeze their eggs will actually conceive. But do the women interested in this procedure really understand those odds?
I hear it's 80%.
50%?
I really don't know.
In fact, fertility doctor Stephanie Thompson
Good evening, ladies.
has been freezing women's eggs for 2 years. But because the procedure is still so new, it's hard to get a handle on how successful it ultimately will be. Still, she hasn't had a success story yet.
I haven't personally had someone who's had a baby yet. I think I probably tend to get a lot of the younger patients, and they're not quite ready.
Another caveat, egg freezing is expensive, costing as much as $6,000 to $15,000 per treatment. While contraception allowed women to avoid becoming young mothers, egg freezing could allow them to become older ones. It's a hopeful message for women who are trying to have it all. But is it really worth your investment?
Amanda and Vicky are here. They both decided to freeze their eggs. So, Amanda, you're in your early 30s, I'm told.
Yep.
I can reveal that.
Yes, you can.
What catalyzed you to freeze your eggs?
Well, it's crazy. If you asked me a year ago, I had actually never heard of the process and had no idea what it was. But I have friends who are in their late 30s who have had fertility struggles, and they all said if they had known one thing, they would have recommended it or they would have gone through the process when they were my age.
So, Vicky, you say that the procedure made you feel accomplished and secure. Those are your words.
Yes.
Why is that?
I liken it to the feeling that my friends have when they get engaged and they've got a big part of their life figured out. After I got out of surgery, I realized that there was this huge puzzle piece that I had fulfilled on my own without a need for anybody else.
All right, so let me bring some experts into this. Since 2009, the popularity of egg freezing has increased tenfold. And here's how it's done. Take a look.
Hi, Dominique. How are you? Good to see you.
The concept is simple, but the practice of freezing your eggs is surprisingly complex. It takes time and work, and sometimes discomfort for the patient. There are 3 main steps. The first, ovarian stimulation.
You want to put the needle in before you actually push the plunger. Okay?
A woman freezing her eggs must inject herself daily with fertility drugs for about 2 weeks to stimulate egg production. The side effects?
Bloating towards the end, that's just your ovaries getting larger, the pain of the injection site, and a little bruising.
Step 2, egg retrieval. Using this foot-long needle, the doctor retrieves your eggs while you're under anesthesia. She can see exactly what's going on with ultrasound.
In terms of egg freezing and family building, we'd like to see the patient have 15 to 20 eggs.
And finally, step 3, egg freezing. Using a microscope, an embryologist identifies the healthy eggs. Then they're ready to be dropped into tanks filled with liquid nitrogen for around $500 per year in storage fees. And there they'll stay until the woman decides to use them.
So So I asked two experts to join me. They're infertility experts in this field. Dr. Stephanie Marshall-Thompson is a reproductive endocrinologist at the Institute of Reproductive Medicine and Science at St. Barnabas Hospital. Dr. Samantha Butts, an associate professor of OBGYN at the Hospital of the University of Pennsylvania. And both of you agree that the procedure is safe. But I'd love to know how you would rate egg freezing as an insurance policy, which is how a lot of women are seeing it. And I'd like to know also, would you do it for yourselves?
I would absolutely do it myself. And like I said, they did it at a great age. Between 25 to 35 is about the right time you want to think about it.
Dr. Butt?
I would describe egg freezing as an option with significant promise for women to mold their fertility options, but it won't necessarily work for all women. So since there's no guarantee that freezing any amount of eggs will result in a future pregnancy, we can't really call it an insurance policy at this point. That said, we know that it's no longer experimental. We believe that it's safe, and given those things, I think it's something I would definitely consider.
For yourself?
Yes.
All right, we got 2 yays for that and 2 yays up here. Yeah. All right, thanks for sharing your stories. It has been called an anonymous epidemic. Almost 7 million women have fertility issues, but until now, talking has been strictly taboo. But that taboo is starting to crack, bringing infertility finally out of the shadows. Chrissy Teigen just revealed she and her husband, John Legend, are having problems conceiving. Julianne and Bill Rancic were on the show talking about it. Brooke Shields, even Mark Zuckerberg have opened up about their struggles. Now, their stories remind us of the pressure many women feel to have children at some point in their lives. So today, let's have an open and honest conversation about infertility. I've got 2 world experts to help me out. Dr. Samantha Butts and Dr. Stephanie Thompson are here. And many of the women in my audience today have had issues with infertility. So I want to hear from you. So let's start off. Why is it so hard to open up about infertility? How are you? What's your name?
I'm Jen.
Hi, Jen.
I think it's hard to open up about infertility because it is a deeply personal issue. It's, involving, you and your husband or your partner. And it's something that women feel like they're supposed to be able to do. So there's a sense of failure when you're not able to, come through and conceive a child and have a live baby. It just feels like a failure, and nobody really wants to bring that forth and talk about that amongst your friends. It's not, wine night conversation.
It's hard to break the ice on that.
It is.
Dr. Thompson, what do you tell your patients when they're struggling to get pregnant and they don't feel happy that it's common? It doesn't make my pain any better that there are more than 7 million people just like me.
Yep. They always ask, why me? Or is it me or is it him? And I tell them the reality is that most people just don't talk about it, and most people don't get pregnant within the first month, so you should never feel bad about that as well. And for patients who are under 35, really trying for a year is the ideal time before you want to come in and talk about it. So I do reassure them about that timeline. And if those who are over 35, 6 months is when you want to seek care. And the workup is so simple and easy and quick and empowering for them.
Yeah. I was talking to one of my colleagues about this, a female producer on the show, and she said, the reality is that 5% of people have it really easy, and they're really public about it.
Right.
And 95% of people struggle at some point with this, and they don't tell anybody.
Absolutely.
So you get a very skewed view of reality. And when you realize that, that's why it's so important, people who are having an issue, to speak up about it. So I appreciate you guys being upfront about that. When you see celebrities like Chrissy Teigen and Brooke Shields, you start to feel, well, you know what, if they're having an issue, I've got an issue. Does that make you more comfortable, more happy about talking about it? Does celebrity speaking out make it easier?
I think it makes it easier because a lot of times you have trouble talking to your family, and when when your family sees the celebrities that they look up to actually share their story, then it makes it easier for you to talk to them and say, yeah, I'm going through this too. And it kind of removes the stigma and the fear that you have in sharing something so personal with the people that you care the most about.
Listen, I appreciate you all speaking about this. We have to remove the stigma associated with infertility. Infertility is not a question of fault. We've addressed that today. It's not a question of fault. It's an issue of biology. No one should be stigmatized on how your body functions. Thank you for watching. Don't forget to subscribe and turn on notifications so you never miss out on new videos to live the good life.